Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I was projecting from the diaphragm there to
Yeah,
speak well.
I'm going to start doing
that
that too, yeah.
All right, single most important knee exercise before and after total knee replacement or maybe a meniscus surgery, really most knee surgeries.
Right.
We're going to cover that today.
And we're therapists, and this is our specialty. So if you're going to have a surgery, this is a really important video to get you prepared for surgery so the surgery goes better and your rehab goes much better and faster. So, Bob, what do you say about that?
If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free. We upload every day. Also go over to the Facebooks and like us because Brad and I, as children, we're not liked and we're trying to turn things around. Bob and Brad.
You say that now, but what do you really mean?
I really mean that we were not liked and now we're trying to turn things around.
Here we go.
Okay.
So the single most important exercise for a knee is you need to get the knee moving and have full range of motion. It boils down to that.
I have this talk with every one of my patients after knee replacement, Brad. I go, it's a race against scar tissue.
Sure.
Your scar tissue is getting laid down after surgery.
Right.
And I can tell you, your knee's going to get strong. Mm-hmm. They always get strong.
Sure.
But there's no guarantee you're going to get the full motion back or the full, the full bend back or the full extension unless you start working on it right away.
So you want that knee to be as straight as you can get it and bend it as far as you can, not only after surgery, but before.
Because the more you get before, the better the surgery is going to turn out.
So precisely, Bob.
And with arthritis, a lot of times, or with knee injuries, a lot of times you're lacking that motion. So we want to start working on it right away.
And along goes with that is typically, whether it's meniscus or knee arthritis, it hurts to put weight on the knee and walk and do exercises. So the next best thing is non-weight bearing range of motion. And it just so happens that Bob and I have been struggling with this for years, and we decided to actually...
We came up with our own answer.
Yeah, we invented, we call it the knee glide, and it works wonderfully for these surgeries before and afterwards. And it's really, it's an inexpensive device, especially when you're talking a $20,000 surgery.
$20,000 or $30,000 surgery.
Right, yeah, they keep going
depending
up,
where you have it done at.
Yeah. So how are we going to get the range of motion? No, non-weight bearing. We can't walk on it easily and put weight on it. So we want to do something in a seated position, and you want to get your knee moving. And so this are actually going to go in 3 phases, Bob. First thing we're going to do is a mid-range, and that's right in here. And if this is going pretty good, it might be tight, and you're just going to work it.
What's nice about this too is if you still maybe have some cartilage left, you're starting to promote the natural lubricant in your knee.
Right, get that synovial fluid working.
Synovial fluid going, which always reminds me of the one patient who called it snowmobile fluid. So it's synovial.
Yeah, synovial, not
But this will actually help promote that and actually create more, and it'll get more blood flow to the knee. So it's good and healthy for the knee.
Right. Now, once you get, if you're doing this for a few minutes, then the mid-range, which I'm calling this the mid-range, feels good. Then you want to go to full extension. You could go to bending it, but we're going to go to full extension first. And so we're going to go out like this, and there's a few little tricks I'm going to show you. You can just simply put your hands above the kneecap there. You're going to straighten it, and we're going to do a little pressure on and pressure off. Pressure on.
He's actually saying the words because it tells you how long to push. Pressure on, pressure off. And what's nice about an exercise like this is if you really should try to do it quite frequently. I mean, not just once a day. I mean, every hour, if you have the time, especially after knee replacement, you want to go ahead and do 10 or 20 of these, and you're going to get much better results than if you just focus on it once a day.
Right.
So now, you can also...
I'm going to show you the trick. The really nice thing about this device is it's got a handle that actually works as a stilt. So now I'm going downhill, and it's a little easier to get that full extension. And so that's just one of the cutest little things on this device that we just love. And, therapists really enjoy that, too, because it's something you can't do if you just...
We're really proud of this.
Yeah, we are.
And the other thing, Brad, I just want to, while you're pulling that out, I'm going to point out how light this thing is. I always like to show that I can do finger curls with this. Yeah. I mean, it's less than 3 pounds. 3 pounds?
Yeah, it's right around 3. It's
so-
2.9, 3.1, whatever.
So you can take it wherever you are going. I mean, you can, you know, if you're an elderly person, you can bring it into your living room and
Sure.
and work with it while you're watching Maude on TV. I don't know.
Well, here you can put it up on a platform like this if you want to. It just raises it up for full extension. Sometimes that helps.
Yeah,
It's up to
I've
you.
had some patients where it works out better for that.
Yeah. So once you get it so it fully straightens, then we also want to get it to fully bend. Now this, it does not work well to use this typically. And usually I do this one on the flat. And then we're going to work full bend or flexion, we call that. And a lot of times you can go like this and help. The strong leg's going to help the weak leg.
Yeah, so he's crossing around at the ankle, then he
Yeah.
gets so far back. If that gets to be too far back, then he can actually put the heel on the tip
There
of
you
the,
go.
and push it even further back. And now, this was one that was kind of revealing to me, Brad. My wife was having a problem with her knee, and she was working on this. This was not comfortable to her unless she had it up on the stilt.
Oh,
Because the ankle.
which
yeah,
way did she do it?
The other way.
This way?
Yep.
Yep.
Yeah, it was too flat and it was too hard on her ankle. So this, you can see this is a little more easier on the ankle as you're doing it.
And then you're going downhill, which it's
Right.
amazing what the difference that makes as far as resistance. There's very little resistance on this. It floats really nicely.
So we were, in her case, she wasn't even having a knee replacement. She wasn't having any knee surgery. She had some knee pain that creeped up, and I just wanted to get range of motion in there to help
Sure.
get the fluid going, and it helped. I mean, she's now walking again, fine.
It's amazing when you get a knee moving, full range of motion, fully
Yeah.
extended and fully flexed. That alone can help eliminate
Really
pain.
decrease the pain. Maybe you won't even need surgery if you know.
Right, right. And we've both experienced that in the clinic.
The problem is, you know, when your knee starts to hurt, what do? You stop moving it.
You guard it,
Yeah,
right?
you guard it. So then it even makes it worse,
Right.
because there's no blood flowing to
Right.
it. So
And we've got a number of videos on other little tricks to get a knee to move.
Sure.
Now, once you do get to the point, and this may take, you're not going to get full range of motion probably in one day. It may take a week or so of doing this. It all depends on how tight your knee is. But once you get full extension and you get full bending and it's going pretty good, and it's like, wow, this is going pretty easy. Now what do? I got a week before surgery. Then you can start to strengthen it a little bit. Now,
Sure.
what really works well is you can use this. If you want to strengthen your hamstrings going uphill like this, you'll find that do this for a couple minutes. You'll feel those hamstrings working more. It's not a big jump. That's more for after surgery, but it still works good for before surgery.
it still focuses on those
Yeah,
muscles.
this one focuses on the quadriceps. But if you really want to get more, particularly with the hamstrings, you take a stretch band like this and you get a Velcro strap. You don't have to have the Velcro strap. You can just wrap it around your ankle, but the strap works a little bit better.
And a lot of the kits, you know, if you get one of the full kits, we have one down below on our Amazon preferred list. Is it the Kinsey?
Kenzie, yep.
Yeah,
K-E-N-Z-I.
it's got the handles, it's got the ankle
Yeah,
straps, it's
yeah.
got it all.
And it was 20-some bucks or
Yeah.
something. Okay, so can you come over here, Lonnie? We got to show, you know, if you want to, you can tie this somehow to the anchor, you know, to
The bedpost.
the bedpost, to a chair, or whatever. We happen to have a nice wall anchor here that you can also get if you want in our
on
preferred
Amazon
list.
page, yeah.
And zoom right in, because we have people ask, well, I really can't see how this works. It works really easy. You just pull a little bit and you slide that in there, and I'm going to come up through here. That's one way. We could put it in through here and work it, around there like that. And
We try to put on the poster that comes with it that a lot of different ways that you can do it, but there's a lot of them that we even haven't thought of yet, Brad.
Yeah.
I think that
it makes it kind of fun. It's kind of like one
Yeah.
of those things. So now we got a little resistance. So now we got full range of motion. You're on your final phase before surgery or afterwards when you want to strengthen it. And this really, if you try doing it like this, where you're holding your leg up versus relaxing it, really makes a big difference.
this is a great exercise
Yeah.
after the knee replacement or the meniscus. I mean, just a low impact, but really focused on those muscles.
And very controlled, because after surgery, when you get knee pain, if things are controlled, you're more relaxed and everything works better. Now we can do this the opposite direction as well. Sneak underneath the chair and simply get some resistance going the other way and work those quadriceps.
Wonderful.
Yeah. Bob, it's all
like
fun.
magic.
Yeah, there's just so many ways to get success with therapy, and this is one of the newest things.
So many ways to skin a cat. Wasn't that the saying?
Well, yeah, but you know how...
That's kind of violent, isn't it?
Yeah, we don't want to talk about that, but
Okay.
this is a wonderful thing. Once again, Bob, we can cure just about anything.
We can fix just about anything except a broken heart.
There you go.
But we are working on it day and night. I'm tired.
This is fun, Bob.